Canine adrenal tumors include adrenal adenomas, carcinomas, pheochromocytomas, and tumors that metastasize to the adrenal gland. Adrenal adenomas and carcinomas arise from the three zones of the adrenal cortex where adrenal steroid hormones are synthesized. In general, adrenal adenomas still retain the normal adrenal shape, while adrenal carcinomas tend to lose normal adrenal shape. About 50% of adrenal tumors are adenomas and 50% are carcinomas. Pheochromocytomas arise from the adrenal medulla and produce excess catecholamines. Adrenal tumors may be functional or non-functional. Surgical removal of adrenal masses discovered incidentally and thought to be non-functional resulted in improved demeanor of the animal despite a lack of previous recognition of clinical signs. Hyperechoic foci, or acoustic shadowing within an enlarged adrenal gland, suggests a tumor. About 50% of tumors, adenomas or carcinomas, are mineralized. If present, metastasis most commonly occurs to the liver. Adrenal tumors can affect one or both poles of the left adrenal gland. Adrenal tumors can affect one, or rarely, both adrenal glands. Usually, when one gland is affected, the other becomes atrophied and non-functional. About 1/3 of adrenal tumors in cats are malignant. Unilateral adrenalectomy is the treatment of choice for adrenal tumors. Some adrenal tumors in cats have been associated with high levels of adrenal hormones other than cortisol. This should be suspected in cats with signs of Cushing's disease, an adrenal mass, and low cortisol levels on an ACTH stimulation test. Conn syndrome is the result of hyperaldosteronism. The disease is seen most commonly in cats with a unilateral or bilateral aldosterone-secreting adrenal tumor. In some cats, on ultrasound, the adrenals may appear normal or slightly enlarged. It can also occur with a non-tumorous micronodular hyperplasia of the adrenals. This disease should be considered in middle-aged or older cats with hypokalemia, polymyopathy, and/or systemic hypertension, and should no longer be considered to be a rare condition. Patients may show episodic lameness or weakness, polyuria, polydipsia, vision loss, polyphagia, and weight loss. Hypokalemia causes muscle weakness. Spironolactone, ACE inhibitors, and calcium channel blockers can be used to help control hypertension. Spironolactone alone may be effective in controlling the hypertension. Surgical removal of the adrenal tumor is the preferred treatment. An important part of the ultrasound exam of a patient with a suspected adrenal tumor is to be able to inform the owner if there is a possible metastatic lesion. Metastasis occurs most frequently to the liver. If the owner wants to pursue surgery, biopsy of the suspected metastatic lesion is indicated prior to surgery. It is good practice to use color flow Doppler when evaluating suspected adrenal tumors. An adrenal mass with little vascularity may outgrow its blood supply and begin a process of necrosis. Fine needle biopsy could be considered in a mass with poor vascularity if the pet owner is willing to proceed to surgical removal of the mass. An adrenal mass with extensive vascularity may contribute to thrombus formation and should not undergo fine needle biopsy. Needle biopsy of a mass with extensive vascularity could result in rapid hemorrhage and death of the patient. A vital part of the ultrasound exam of a patient with a suspected adrenal tumor is to be able to inform the owner and a surgeon if local invasion of a blood vessel or organ is evident. Adrenal tumors are known to locally invade the kidney, renal artery, renal vein, aorta, or caudal vena cava, and to metastasize to distant sites. Tumor invasion of the aorta or caudal vena cava indicates a poor prognosis. Sometimes the tumor can be debulked to reduce symptoms and prolong life. On rare occasions with an adrenal tumor invading the caudal vena cava, the tumor and portion of the caudal vena cava can be surgically resected and replaced with femoral vein. Surgery of an adrenal tumor can have high risk and multiple complications. Adrenal tumors are often highly fragile and may rupture with or without surgical manipulation, leading to hemorrhage and death. Immediately after successful surgery, older animals often develop acute renal failure and require several days of intensive fluid therapy to recover.